Patients get tired of taking medication to control their pain. They're looking for something else in order to help them avoid taking pain medication.
One of the advantages of using pain management techniques, especially injections, is that we can do the same job that oral pills will do, but we can do it with a lot less medication, with a lot less side effects to the patient.
There are some medications that are anti-inflammatory, and there are some medications which are anti-pain. But no matter what medication you take orally, there are side effects, and some of those side effects are just not pleasant. There's fatigue, or you can't sleep. You're groggy. You can't operate your car or equipment, so it makes it hard to work during the day.
The pain medication really didn't, from my doctor, didn't help. Since it's a nerve pain, it's kind of hard to control with medications.
I had gone to other doctors and they wanted to try to do surgery, and I'm not a surgery type of person.
Once we determine where we think the most likely cause of the pain is, we look at their x-rays. We also use the fluoroscopy to guide us as to where to put the medication that's going to do the best job. Sometimes they're the source of the pain, sometimes they're not. Sometimes we do diagnostic injections to tell us if that's the place where it's coming from, and if it is, then we also use a therapeutic injection.
He will utilize scientifically proven technology in order to pinpoint exactly where the pain is so that we can help people lower their pain as soon as possible.
I've had a couple of rounds of injections. I'd say I'm probably back 90%.
I had terrible migraines, and I had tingling in my fingers. And it was going on for quite some time and getting worse.
And video fluoroscopy is basically an x-ray where he can see exactly where to place his needle in order to decrease a patient's pain.
And I can go 3 to 4 months now without getting shots. And I know when I need to come in because my hand will start tingling, and the pain gets really bad when I try to hold something. So then I know that it's time for me to come in and get shots.
What we do is we give injections as close as possible to the areas of the pathology. Sometimes they're the source of the pain, sometimes they're not. Sometimes we do diagnostic injections to tell us if that's the place where it's coming from, and if it is, then we also use a therapeutic injection. And for the most part, that will relieve their pain very quickly.
Oftentimes, physicians will blindly go in with a needle and guess where to put the pain medication, and you can't be accurate by using your hands or by guessing where the joint is if that's what he's trying to address. But using the video fluoroscopy, he can actually see a picture just like an x-ray. It basically sees bones, and it also sees joint spaces. And if you can see the joint space, which is a lot of times where the pain is, but you can also see where the nerve comes out. Now, you can't see the nerve, but you can see where it goes out, and oftentimes he will utilize medication where the nerve comes out because people have nerve pain.
It wasn't a sudden thing. It was a gradual increase in pain, lower back pain. My life's changed a lot. People at work notice it. They say I'm glowing. My eyes are clear. I'm finally getting sleep. I'm not waking up in the middle of the night in pain anymore. So it's huge. And it's been 7 years that I haven't felt this good.
When you utilize pain management intervention injections, what we're trying to do is lower the inflammation in the joint or around the nerve. When you lower the inflammation, you lower pain. If you lower the pain, then an individual can be more active in their life.
I had gone to another pain clinic before, and they were doing some epidural stuff where they totally knocked you out, and it didn't do anything for me. But here, I was amazed. I was a little scared when they first said the injections, but they're pain-free, and they're quick, and they do work.
When we recommend injections, people are a little taken back because it's a needle. We basically spray ethyl chloride, which is a cold spray, on the area where he's going to inject, and all you feel is a little pinprick. But the medication that little needle delivers lowers the inflammation, which lowers pain.
Dr. Morgan and Dr. Wetherington, they don't just jump into anything. They make you feel comfortable. They make you feel okay with what they're doing. And I was very skeptical. I wanted to know exactly everything that was going in my body. And they took their time until I felt comfortable, and then we went forward with that. And it truly did help enormously.
We are very clear when we talk to people about lowering their pain that sometimes we will get pain relief or elimination of pain in a week or two, but oftentimes it takes 4 to 6 weeks to see results from our pain management programs. Doing the injections themselves, sometimes there's relief in 1 or 2 days. Sometimes it takes a second or third procedure. But again, it depends on the patient and how long they've had the pain and where the pain is and exactly what type of pain it is. The injections is just one modality that we use at our office. We like to use the injections because it lowers the inflammation rather quickly. That makes the therapy more effective.
We found that with the injections combined with physical therapy, with occupational therapy, it makes we get better outcomes because the patients know what to do next. They know what to do when they leave the door here. They've got some education. They know a lot more about their pain. They know a lot where it's coming from and why it's there.
I can play with my kids. I can go months and months without a terrible headache. I can brush my hair because in the beginning I would drop the hairbrush. I couldn't actually hold on to anything. So it's been fantastic.